So I want to just briefly, we've heard about a lot of these, I just want to briefly go through some of the barriers that we've identified and others, everyone has identified these barriers to genetic counseling and genetic testing. So first, knowledge and awareness. We've heard about this today. This is on the part of providers and is manifested in low referral rates or the inability of providers to deliver genetic information to patients, to recognize patients who should be referred for genetic counseling and testing. And it's also at the general population level. The way that genetic counseling and as a result genetic testing typically works is it's by referral. Either a physician refers you or you refer yourself. And so if knowledge is low up front, referral is going to be low. Access. Access is a huge issue with the traditional model of delivering genetic counseling and genetic testing. How is that done? As I said, a patient who has to first, a patient or someone from the general population who's healthy has to first either recognize him or herself that they're a candidate for genetic counseling, or that has to be recognized by a physician. So there's the first barrier. Then the person has to be referred for individual, and this is changing, but just to generalize, for individual in-person genetic counseling. Typically that first session might last 45 minutes to an hour or more. Patient has to travel to a clinic. Patient then provides DNA for genetic testing if that's what they choose to do. And then when the result is available, the clinic calls the patient back, schedules a follow-up appointment, patient comes in, patient has a session where they learn their test result. Again, this is evolving, but this is the traditional model. This creates all sorts of barriers. There are barriers in terms of access. There's patients have to travel a long distance to the clinic, but most importantly, this is a labor-intensive operation, right? To schedule these patients, to see these patients individually. Genetic counselors can't see patients every 15 minutes. It's much more intensive than that. So it's labor intensive, and yet we have a shortage of genetics providers. So we don't have enough genetics providers to deliver genetic counseling in the way that the traditional model says we should deliver it. Beyond a shortage, genetic professionals are not evenly distributed across the country. There are lots of areas in this country where there's not a cancer genetic counselor for hundreds of miles. We've done studies in rural areas where patients just can't get access to a genetic counselor who knows anything about cancer. So there's a shortage, there's an unequal geographic distribution, the referral-based model is not integrated into clinical care, it's not proactive, we're not identifying patients in the clinic. Again, this is changing, I hope, but we're typically not identifying patients in the clinic and having a genetic professional in the clinic who can see patients when they're there. Instead, if they're identified, they're referred out. Patients have to then come make another trip. So this creates all sorts of issues related to time, related to distance that they have to travel, creates socioeconomic barriers. There's the cost of counseling, the cost of testing, there's insurance coverage. But in addition, there are more straightforward barriers like, who's going to take care of my kids? How do I take a day off from work to do this? So all sorts of barriers, most of which we've heard about. I'm not going to go through this, but these are important barriers to counseling and testing.